Since 1999, we've seen a quadrupling in the amount of opiate prescribed and a quadrupling of the amount of opiate deaths in the United States. So more people are dying from prescribed opiate overdose than car accidents.
Opiate addiction has skyrocketed across the United States. In response, the medical community has created a two-part plan: help current addicts break free from addiction and prevent new patients from becoming addicts in the future.
I mean, they're just miserable. It's like running to keep up with nothing.
When it comes to part one of that plan, Dr. Brad Noble says the most effective way to quit is enrolling in a 12-step addiction recovery program and using a new medication called Suboxone.
Suboxone is a medicine we use for opiate treatment. It has an opiate and an opioid blocker in it that sort of chains up the disease of addiction long enough for the patient to develop sort of a recovery plan that works for them.
Suboxone works kind of like methadone, but instead of having to report to a methadone clinic every day, patients can get a month's supply of Suboxone at one time. But Noble says even with a support group and the assistance of an opioid blocker, breaking an addiction is a challenge.
Opiate dependence is extremely difficult to treat, and no matter how you go about it, you've got a 5 or 10% chance, if you're a real addict, of successful treatment long term.
That means there's only a 5 to 10% chance of beating the addiction. Now for part two, preventing patients from becoming addicts in the future. Dr. Maria Kaufman says in light of the increase in opioid misuse, the medical community has started to rely less on prescription drugs to treat pain and instead placed a stronger emphasis on alternative treatments.
There's been a pendulum swing in general with healthcare, coming back to basics.
Cool or warm packs, braces, even keeping a positive attitude.
It sounds like it's new, but it predates all the pharmacy.
Kaufman says doctors often assume their patients have already tried these home remedies before they come in to receive pain medication. But that's often not the case.
We're so advanced in healthcare and medicine in the United States that we almost take it as a given that the basic measures have already happened at home before someone comes in.
She says people need to give these old grandma remedies a try before they consult their doctor about receiving narcotics. Both Kaufman and Noble agree opioids are an effective way to treat acute or ongoing pain, but at the same time, they're not miracle drugs.
Opiates alone are not the answer. We want to prescribe these medications in a responsible fashion with urine drug testing and pill counts, and we want to offer alternative methods to manage pain in addition to the opiate if it's prescribed.
Noble says between 15 and 20% of patients who take opiates will misuse the drugs at some point. He says at first, prescription narcotics can feel like performance-enhancing drugs, but that feeling of invincibility quickly turns into a dependency.